Hi, this is Dr. Cliff Grunstead coming to you with another Dr. Cliff's Riffs. Tonight we're going to be talking about seasonal affective disorder. There's a good friend of mine and colleague, psychiatrist, who was talking about the winter doldrums and the seasonal effect that low light and change of season has on people, and ways that we can help self-treat to some degree. And I thought I would just run through some of the suggestions that the therapist, the psychiatrist had recommended, and that she recommends for her patients. So to get right into it, the brain obviously is affected by the altered sunlight, the lower sun in the sky, less light, and it starts to wear on the psyche, especially when you're inside, especially in the cold, if you're living in a cold environment like Boulder, Colorado. Well, one of the easiest treatments that you can do is using light therapy. The light box that you can buy on the internet mimics natural sunlight. It regulates the mood and circadian rhythms, and it's usually very helpful for increasing your mood. The typical light you want is 1000 lux. You want to do it for about 30 minutes a day, usually in the morning. If it starts to affect your sleep at night, then you may want to cut it back. But using it from Labor Day through the springtime is totally fine. If you tend to get a little bit more energized by it, then you may need to be careful about using it. But it is a very easy to use therapy. Again, 30 minutes in the morning when you wake up, just to mimic natural sunlight. Then there's supplements, things like vitamin D3. D3 is oftentimes diminished during the winter, not only because we're outside less and we don't get the natural vitamin D production that our bodies create, but the angle of the sun is also decreased to create the endogenous D3 creation. So my colleague recommended anywhere from 4 to 5,000 of vitamin D3 supplements. You can take it with vitamin K2, 50 to 100 micrograms, to supplement the D3 effect as well. So that may boost your energy level. It also boosts your immune system, and it's good for the bones and general health. It's hard to become toxic on vitamin D. It is a fat-soluble vitamin. They always warn you about not taking too much, but taking 5,000 units a day for several months is certainly in the safe zone. You may want to consult with your physician, maybe get labs checked before you start the vitamin D supplementation. And even the vitamin D ranges that they have in the labs may be, if you're on the low end of the normal range, you may want to try to supplement with the vitamin D. Getting good sleep is paramount. Just just that alone will increase your mood. Usually you want anywhere from 6 to 8 hours of good sleep. You don't want to oversleep because that can actually affect your mood. But good sleep is very, very helpful and can be therapeutic, not only for your mood, but also for your general health. If you need help getting to sleep, there are supplements like magnesium glycinate, and you can take some L-theanine as a supplement. You can even use some of the natural over-the-counter type of uh, ingredients like tea, sleepy time tea or chamomile tea, that can supplement your sleep, at least getting to sleep. Maintaining sleep is sometimes difficult, but the rule of thumb is if you're awake in the middle of the night and you're not getting back to sleep in 10 minutes, get out of bed, go read something boring like the dictionary, go back to bed when you feel sleepy, so you associate the pillow with sleep. Try not to read in bed, because that will associate your brain with being in bed and awake. So try to read somewhere else, separate the bed from any kind of high-level brain activity. Exercise is always helpful. 15 minutes a day, if you can get your heart rate up to a reasonable degree. And typically the rule of thumb for exercise is try to get to the point where it's kind of easy, kind of hard. You can just ask yourself, is this stair climbing kind of easy? And if it's really easy, pick it up. If it's really hard, back it off, but 15 minutes a day is usually enough to kind of boost the natural endorphins in your body and also improve your general health, sleep, and overall well-being. Try not to exercise before you go to sleep, however, because your catecholamines, your natural endorphins, will rise from exercise, and that might inhibit your sleep. Relaxation is also key. Meditation, doing things that calm, being appreciative for some of the things you have, but really taking the time, disconnect from digital world, just see if things can just calm down. That can, by itself, elevate your mood overall and become grateful for what you have, rather than perseverating or focusing on the negative. A good diet is self-explanatory. That's for any time of year, but especially during the winter doldrums, getting good food with maybe less carbs, less sugar, less alcohol if possible, and trying to eat well is really a wonderful, easy way to just improve your overall mood. There are vitamins like vitamin B12 and folate that can supplement your mood naturally. B12 and folate are water-soluble vitamins, so you do not absorb they do not stay in your body like vitamin D, but they can be very effective for elevating your mood. They are natural precursors to some of the neurotransmitters that regulate our moods. Oftentimes people will benefit from methylated B12 and methylated folate because those come pre-activated. Some people don't have the enzymes in their liver to actually turn the B12 and folate on to an active form, so you're basically swallowing an inert pill that just gets excreted out without having any benefit. So paying a little bit of extra, getting the methylated version of the B12 and folate can be very helpful. Cognitive behavioral therapy can be helpful. Just learning to identify times where you're thinking negatively and try to flip it so that you are self-aware and flip it to a positive. Trying to modify some of the thought processes with cognitive behavioral therapy is very, very helpful. You can research that yourself, but that can be in itself very, very helpful for just maintaining the mood and energy level. Socialization is another one that naturally will boost your endorphins, your natural brain chemistry, so that you feel better, you move better, and it's proven that isolation can harm your health, can harm your overall psyche. And socializing, even at the grocery store or some other menial place, a coffee shop, or even in the street, just striking up conversations with people can be quite helpful. And then, of course, there is antidepressants. Antidepressants to get through the winter doldrums may be helpful. That, of course, would come with professional counseling and prescriptions, but that may be helpful in itself if you really get down during the winter. And then just getting outside, increasing your outdoor activity during the daylight hours is a natural endorphin booster. And when you can, given safety, assuming that you're not going to fall on the curb and break something, getting outside when you can, even for 15 to 30 minutes a day, will be a natural endorphin booster. So I hope that's helpful for you. I hope you enjoy the winter months. For those that enjoy the winter, it's not easy. Assuming it's not hard to get through, because that's what they live for. For those that are more inclined to stay inside and feel a little bit claustrophobic and pent up or closed in, using some of these techniques may be helpful for you. Hope that's helpful for you. If you have any questions, you can certainly call us, and we'll see you next time for another Cliff's Riffs. Take care.